Well, as a matter of fact, and good morning, Andrew, I have the opportunity to talk to a member of President Macron's team about how we can work together in order to combat coronavirus. And, of course, it's also the case that negotiations are going on with our team led by David Frost and, of course, with Michel Barnier.
Everyone wants to know the answer to a straightforward question. The Prime Minister told us that this period of lockdown would end on December the 3rd, in 4 weeks' time. Is that absolutely certain?
It's our fervent hope, yes.
But is it going to happen if, for instance, the R rate is still rising or is not below 1 at that point? Do you carry on with the lockdown, as Jeremy Farrar and others have suggested?
Yes, I listened to Professor Farrar and also, of course, to Keir Starmer earlier, and I think they made fair points. I think that what we need to do is to recognise, and I'm sure we'll go into the reasons why these measures are appropriate, but we need to recognise that we do need to get the infection rate, the R rate, below 1. We believe, on the basis of the evidence that we have, that we will be able to do so, and that from the 2nd of December, we'll be able to move back to a fully regional approach, a tiered approach. But obviously, we will be guided by the facts. And given, of course, the way in which the virus has shown a particular malignancy in the course of the last 2 weeks, we do need to be vigilant. But our assumption, on the basis of everything that we know, is that we will be able to exit these national restrictions on the 2nd of December.
But it sounds like now there is a kind of consensus that if the R rate is not low enough and infections are still going up, that'll go on. Next question is what happens when we do exit this lockdown, because Jeremy Farrar was suggesting that it will be like Tier 3, but more so restrictions across the entire country. That's pubs closed, restaurants closed, most shops closed, people not allowed to visit each other's houses and so forth, and that could go on for some time.
Well, again, I'm a great fan of Sir Jeremy and always listen with interest to the points that he makes. But I think it's important that we don't get entirely ahead of ourselves here. I think the first thing to say is that the reason why we need to take these steps is because of the danger of the NHS being overwhelmed. None of us relish taking these steps. If we can succeed through all of the measures we're taking in getting the R rate down, we can look at which restrictions can be lifted where.
Maybe the British people are tough enough not to need optimism, but to be able to deal with reality. I mean, the French, for instance, have said there's going to be tough measures after their lockdown. Can't we be straight with people and say the same is likely to happen here?
Well, I will be straight with people. It is the case that even if, and I fervently hope this is the case, and I expect it is the case, that we do exit all of these national measures on December the 2nd, we won't be going back to life before COVID. We have to live with this virus, and it will be the case that there will be restrictions, particularly in certain areas, where we want to be uniquely vigilant in making sure that we don't see a resurgence in reinfection.
So in sum, the lockdown could be extended, and people certainly in some areas will face more restrictions afterwards.
Yes, but if we ensure that all the steps that we're taking now are taken appropriately, we'll have an opportunity in advance of December the 2nd to review the progress that we're making, and in advance of December the 2nd, we can then communicate to those areas where some restrictions may be required, what they will be, and also other areas where we've managed to beat back the virus, we can explain where liberties can be restored.
Are you absolutely committed to keeping schools open whatever happens?
Yes, absolutely.
Even if the virus is progressing very fast in schools, you'll still keep them open?
Well, all the evidence suggests, and again, we will be guided by the evidence and by the emerging consensus. All the evidence suggests that schools are not a centre of infection and that schools are safe, and I was reassured again by what Sir Keir Starmer said earlier.
You say that you're going to follow the evidence. Here is the ONS survey summary. Older teenagers and young adults continue to have the highest positivity rates, while rates appear to be steeply increasing among secondary school children. And Neil Ferguson has said that the challenge may be that we are not able to get on top of the transmission unless we close schools.
Yes, well...
So if that's the evidence, and you say you follow it...
Well, the key thing is, at certain points, you do have to say there are limits to the level of restriction that we are going to impose. The levels of restriction that we're imposing overall are uncomfortable. You know, there are things that we are asking people not to do that, frankly, I hate having to say. So restrictions on, for example, worship on Sunday are deeply, deeply difficult for me to put forward. But what we've got to do is to try to recognise what the bundle of measures are, which will ensure that overall we can reduce R below 1. Now, it's perfectly possible to say if you add these measures, then you can be even more certain of reducing. And it's perfectly possible to say, I prefer to take this one or that one away.
Yes.
But a balance has to be struck. And the balance that we believe is right is continuing with education in the interests of children and also in the interests of their families. But
I'm not...
one of the things I would say is overall, of course, you can't eliminate the spread of infection without closing down the country fully.
Completely.
So there's got to be a balance, and we believe the balance is struck right in this way.
I'm not trying to be silly. I understand these are horrible, horrible choices, but it may well be that you face a choice of closing schools and ending the lockdown relatively earlier, or extending the lockdown longer in order to keep schools open. Which way do you go?
I take your point, but we want to keep schools open.
So you would extend the lockdown and keep schools open if that's what it came to?
I don't believe it will be that case, but I do believe that we want to keep schools open, and I believe that the measures that we're putting in place will enable us to do so.
One thing that was briefed out or leaked out from the government, but then was not discussed in yesterday's press conference, was international travel.
Yes.
Is it the case at the moment, going forward from Thursday, that people who want to fly abroad for a holiday can't?
Yes. Sadly, we're saying that when it comes to international travel, of course, if international travel is required for work or for other critical reasons, there are legitimate exemptions. But from Wednesday night, Thursday morning, our message is that people should stay at home. Obviously, if people need to work, they must be in the workplace, and that, of course, applies to those who are working in schools as well.
Another hammer blow for the airline industry. They're going to get some more help because of this?
Well, overall, the Prime Minister and the Chancellor have been working hard on a package. There's a furlough package that has been outlined, but the Chancellor has shown throughout the coronavirus pandemic that he's always ready to look at creative and appropriate solutions for any sector that's facing particular difficulties.
Well, that takes us all into the area of help for people. And back in March, when the last time things were this bad, the self-employed were getting 80% of their earnings. Now they're getting just 40%. Why?
Well, again, the announcement about furlough that was made yesterday was about the extension of a scheme that would have expired last midnight throughout the rest of this month. And the Chancellor and his team are looking at every aspect of economic support, and more will be said in the days ahead about how we provide it.
So that rather meagre offer to the self-employed of 40%, on which basis lots of people can't really survive, that is going to be looked at again, and that might be extended.
We keep all these things constantly under review. And, of course, the reason why we've taken action, and in a way I think it's understandable that you've almost assumed that action requires to be taken. But I think it's important to, briefly, to remind people why. And the reason why we're taking action is because of the threat and danger to NHS capacity.
I do understand that.
And the prospect of that being overwhelmed. Were that overwhelmed, then the consequences for our economy would be even more terrible.
But let's stay on this furlough scheme, because you'll remember vividly the big argument with Andy Byrne with Manchester and the other northern leaders just a week and a bit ago. And they were asking for 67% to be extended a bit for their workers who are losing their jobs. And they said, be a bit more generous, and the government didn't have the money for it. And now your constituents in Surrey Heath are in the same position. You can suddenly find 80%. Why?
I think there are two things that I draw a distinction on there. The first is that the offer that was being made to people in Greater Manchester and indeed elsewhere would have meant that with the application of a universal credit uplift as well, that people were receiving, those in the most need were receiving 80%, and in some cases slightly more than 80%, of their earnings, but also the restrictions that are now being reluctantly but necessarily put in place are restrictions that go further than anything that has been hitherto put in place, whether in Greater Manchester or elsewhere. So you know, the government is being criticised, if it is being criticised, and I know that you're asking a question rather than offering an opinion, for the generosity of its offer at a time when there is an unprecedented request that we're making of the entire country, a request far greater than the one that was made necessarily in Tier 3, as you say.
Steve Rotherham, who's Mayor of Liverpool City Region and was regarded by the government as a bit of an ally last time round, says, now we know for sure the government thinks workers in the north were worth 13% less than those in the south.
Well, I disagree. And I've got huge respect for Steve Rotherham and the work that he's taken. So I shan't criticise him, but I respectfully disagree because, as we've just discussed, the point we're making is that workers, whether they are in the north or in the south, are being asked, families are being asked to do more than was the case even in the Tier 3 areas.
Let's turn to the situation in the NHS. We know that the NHS is facing a very, very tough time at the moment. Should routine and other operations be cancelled to free up capacity for COVID patients?
It's precisely because we don't want to do that we are taking the steps required. At the moment, if we didn't take the steps that the Prime Minister announced yesterday, then we would see that progressively the NHS would find its capacity overwhelmed. We would find that later this month...
It wouldn't be there for us.
Yes. And the Prime Minister made the point, I think very powerfully last night, that the compact between the British people and the government is that the NHS is there for you. We would face a situation by December the 4th, if we didn't act, that the NHS would be full, not just conventionally full, but every available space and every available corridor taken. And that would mean that people who do suffer from serious conditions, indeed people who suffer heart attacks or strokes or other emergency conditions, simply couldn't be admitted. And we can't have a situation like that.
At this point in the conversation, a lot of people watching will remember those big Nightingale hospitals being opened up to great applause up and down the country. Are they going to be fully ready for COVID patients this time round?
Yes, we will be using every available bed. Now, of course, we can increase capacity to a certain point. We can provide more beds and we can open the Nightingale hospitals. But what we can't do, what no one can do, is to overnight dramatically increase the number of intensive care nurses, anaesthetists and surgeons. And by definition, that is the most difficult thing.
That is the problem. Stephanie Dunn, who's Regional Director of the Royal College of Nursing up in the North West, says, "We are fortunate to have a Nightingale hospital on our doorstep, but with thousands of nurse vacancies across the region, the RCN would like to know how this is going to be staffed." So would the rest of us.
Yes, well, the NHS under Sir Simon Stevens has a detailed plans in order to ensure that as the number of admissions increase, so if required, we can make sure that elective surgery, which it's deeply painful, that some of these operations may have to be postponed and cancelled, but they can be postponed and cancelled so that capacity can be freed in order to look after COVID patients. And one of the things about the Nightingale facilities is that they allow a highly trained intensive care team to potentially look after more patients now than would have been the case hitherto. Okay. And again, a very important point, which I know you know, but
if I know it, don't tell me again.
But others may not, which is that the argument's made, all this focus on COVID, that means that other health outcomes are being neglected. Absolutely not. It's because of COVID getting out of control that we would be in a position where other health outcomes couldn't be addressed, which is why we need to take these steps now.
All right, let's hover over the dramatic nature of the U-turn that your government has just made. Boris Johnson, as I said at the top of the show, said only in September, "I don't want a second national lockdown. I think it would be completely wrong for this country. Can we afford it? I very much doubt that the financial consequences would be anything but disastrous." What's changed?
The virus has proven to be more malignant in the way in which it spread than any of us had anticipated or feared. And I don't want a lockdown. It's the last thing I want. And the Prime Minister, I know, shares that feeling profoundly. None of us want to restrict people's liberty. All of us thought that the right thing to do would be to try to balance, through a regional approach, protection of the NHS in particular areas and the maintenance of the economic life of the country.
My very basic point is you got it wrong. You say that you didn't know what the virus was going to do, but the warnings for SAGE were pretty clear and fairly drastic. So 21st of September, they told you. As over 90% of the population remains susceptible, not acting now, that's back in December, to reduce cases will result in a very large epidemic with catastrophic consequences in terms of direct COVID-related deaths and the ability of the health service to meet needs. And then in October, your own advisers told you we are breaching the number of infections and hospital admissions in the reasonable worst-case planning scenario. The number of daily deaths is now in line with the levels of the reasonable worst case and is almost certain to exceed this within the next 2 weeks. Do you accept, being honest and frank with people watching, that you guys got it wrong And frankly, Keir Starmer got it right.
No, I don't accept that. I'd say three things. The first thing is that the advice that we were receiving at the time indicated that a regional approach was entirely appropriate, and that was the advice from the deputy. No, you read out some quotes, so let me make my case with these three important points. The deputy chief medical officer, Jonathan Van Tam, himself believed and advised us that a regional approach was appropriate. And just a fortnight ago on this programme, you put it to Rachel Reeves. I recognise that it was a question rather than a conviction, but you put it to her that it would be wrong, for example, for someone operating a beach cafe in Penzance to be closed down if the virus was not spreading in the southwest. But it was the case that the numbers increased in every region, including the southwest, and our scientific and medical advisors reflected that change. Second point that I would make is that the Chief Medical Officer last night said there is no perfect time to act.
That's certainly true.
And again, we can reflect as we look back on the evidence, and we can all consider when we might have acted. The third thing is I don't think that it is a criticism of any politician to say that they are reluctant to restrict liberty, but
these things are a balance of
facts.
These things are a balance of judgment.
Of course.
And back in September, you were asked as a government by your scientific advisors to put in place a circuit breaker, and you said no. I'm just saying, you look at the number of infections since then, you look at what's happened, and it is perfectly clear that you got it wrong.
No.
Question mark.
Two things. The first is that there was different advice from different figures, all of them eminent, and I wouldn't criticise any individual for making an argument about what the right time was to act, but on the balance of the judgments that we had in front of us, there was certainly evidence to suggest that acting regionally was appropriate. And I should say that it's not the UK government alone that took that view. If you look at what President Macron said this week to his population, if you look at what Angela Merkel said, France was taking a regional approach, Germany was taking a regional approach, almost every European nation has sought to do so. Okay. But as President Macron outlined, the spread of infection in France is overwhelming.
Yeah, I'm sorry, I'm not suggesting that you are uniquely kind of foolish or anything like that. I'm just suggesting when you look at the facts of what you were asked to do then and what has happened since and what you've had to do now, having derided the Labour Party of the same suggestion, it is fairly clear to a lot of people that you got something wrong.
Well, two things I'd say. One, I am sure that when this pandemic is over and we look back, we will be able to point out that there were certain things that the government got wrong. I'm absolutely certain about that. But
this is one of them, perhaps?
Well, this is the thing. I think it is impossible. I think it is impossible to know definitively. And again, this was a point that President Macron made, which I agree with. It's impossible to know definitively until the end of this pandemic.
Right.
Which were the mistakes and which were the missteps which were most serious. And something that looks like a mistake at a certain point can actually, in retrospect, with more evidence, have been proven to have been right. So I'm not trying to suggest with false ironclad conviction the government gets everything right. Certainly not. But what I'm also saying is that an automatic marking of cards when we're still in the middle of the game. Well, it's not a game. When we're still in the middle of this dreadful exercise, is understandable but not right.
All right. It's been an extraordinary last couple of days. Yes. From the outside, it looks pretty chaotic with a delayed press conference and lots of leaked newspaper stories and then leaks to broadcasters and so forth. Can I ask you, this all started with a meeting in which there were four people present. Yourself, Matt Hancock, the Chancellor and the Prime Minister. Somebody leaked from that meeting. Was it you?
No.
Do you know who it was?
No.
Are we going to find out who it was?
Well,
no.
the Prime Minister has put in place an inquiry, which the Cabinet Secretary is overseeing. There are a number of...
A senior Cabinet Minister leaked something which has caused absolute mayhem for 24 hours.
No. Again, we don't know how that information found itself in the hands of others. All I would say is that there are many meetings that governments have and that ministers have. In those meetings, I think it is important that ministers can speak candidly, that advisers can speak fearlessly. I think it is vitally important that we do that, and that is at the heart of confidence in government. So I regret the fact that this information was shared.
If it turns out that one of your colleagues did leak this information to the newspapers, should they be sacked for it?
Well, as I said on an earlier television programme, it's for the Prime Minister and the Cabinet Secretary to decide what the appropriate steps are.
Michael Gove, thanks very much indeed for joining us today.